Hello everyone, my name is Prutha Rani and the topic provided to me is Prashna Parikshan. So basically, Prashna Parikshan is to understand the medical history, symptoms, mental and physical state of the patient which are covered during the questioning stage. Based upon this diagnosis, treatment and choice of herbs or compound formulas are prescribed.
What happens in a visit to an Ayurvedic practitioner? When you visit an Ayurvedic practitioner, be prepared to talk about yourself because Ayurveda emphasizes balance in all areas of your life. A trained practitioner will not only examine your body but will take an extensive personal and medical history, including questions about your daily diet, profession and working conditions, exercise routines, relationships, and mental health.
To make a diagnosis, the Ayurvedic practitioner uses a method called Rogi Roga Pariksha, which combines diseases analysis with deep examination of each individual. The Ayurvedic practitioner considers the whole human being, believing that people have within them the required energy to bring the body back to a healthy state. According to Ayurveda, diseases are due to a doshic imbalance, determining the patient's dosha and then identifying the root cause of a disease requires precise training.
There are three methods of diagnosis in Ayurveda. First is inspection, which means darshan. Second is questioning, which means prashna. And the third is palpation, which is sparsha.
There are two types of examinations. First, Pratyaksha means direct examination, and second, Anuman, which means inference.
Here we would mostly focus on the topic Prashna Pariksha.
There are 10 types of examination. Prakruti is constitution, Vikruti is disease condition, Sara is tissue vitality, Satmya is adaptability, Pramana is body measure, Samana is body build, Sattva is mental constitution, Ahara Shakti is capacity of digestion, Vyayama is capacity of exercise. Did you know Ayurveda uses the system of Ashtavida Rogi Pariksha or 8 methods to examine a patient? First is pulse diagnosis. This is one of the most significant method of diagnosis in Ayurveda. Many Vaidyas can make the diagnosis only by examining the pulse. This method of diagnosis is known as Nadi Parikshan in Ayurveda. The strength, rhythm, speed, quality of the pulse are examined to come at a conclusion. Urine examination. The urine is examined by naked eye to check for its color, consistency, frequency, and the sediments if any. Stool examination. Direct examination with the fecal matter by naked eye can tell a lot about digestive fire, the color, consistency, floating nature, smell, presence of mucus can give a lot of clues about various doshas imbalances. Eyes examination. The color of sclera, conjunctiva, size of eyeball, dryness, shape, area around eyes give insight into various serious metabolic disorders. Speech or voice examination. The person's ability or strength to speak continuously can give hint about many underlying disease processes. Tongue examination. Following points should be noted: size, shape, color, margins, character, and surface. Normally, the tongue is pink without any coating. It can be whitish due to bad oral hygiene or due to accumulation of amma. The coating due to amma cannot be removed by scraping the tongue. Skin examination. Skin temperature, its color, tender, abnormality in pattern can inform about many chronic diseases. Say for example, the skin of a person with a pitta disorder is hot and a little oily, possibly inflamed. The skin of one with a kapha disorder is cold and damp and generally pale. The skin of one suffering from a vata disorder is cold, dry or rough with possible darkish discolorations. Body examination. Build or general appearance. An experienced Vaidya can get a lot of information from general appearance from the person. The overall build is indicative of the amount of strength, stamina and life force. Also, examination of hair, nails and other body organs can reveal many signs which point towards different diseases. Let's see an example. Rajesh is a 38-year-old male of Indian origin who sought Ayurvedic medical advice for several health problems including toe pain, asthma, skin diseases and anxiety. His Ayurvedic practitioner believed that all diseases has origins in undigested or improperly digested food, which converts into toxins or amma, which is then absorbed by bodily tissues, creating diseases. Thus, he asked Rajesh detailed questions about his diet. Rajesh reported eating a variety of foods including eggs, alcohol, very spicy dishes, pizzas, lentils, and fried foods. In addition to exploring Rajesh's diets, his practitioner explained his very red and inflamed toe, which Rajesh claimed was even more painful after eating lentils and eggs. The practitioner then monitored Rajesh's colon and stomach, assessed his heart and liver, also inspected his tongue and nails for any discoloration or unusual coating. Based on this thorough examination, the practitioner diagnosed that Rajesh's bodily imbalances had caused gout. To elevate this condition as well as create and maintain better health, the practitioner created a health regimen for Rajesh largely based on diet and nutrition. Rajesh was encouraged to avoid spicy and fried foods and fermented items. A diet including buttermilk, carrots and bitter melon was prescribed and a specific herbal remedy. General appearance. The general appearance of the patient reveals a lot of information about the condition of the patient. If the body build is lean or muscular or obese, immediately the physician can conclude about his thorough or optimum condition of the tissues. A physician who cannot enter in the innermost soul of the patient with the aid of the bright lamp of his own knowledge cannot successfully treat any disease. The physician may use any number of instruments and may take the aid of all laboratory tests, but unless he can concentrate his own attention upon the clinical study of the case, he is likely to be misled in his judgment.